One of the things that many of us focused on when we were coming to this college is the whole aspect of being practical. When we went through our education, oftentimes we would learn how to do things, but only in kind of a preliminary way, and then eventually learn to do those things in clinic. So our focus was to stick all the practical parts of the program as early as possible. And so we started even in first quarter having students practice with palpation. In third quarter, they start to actually learn full spine adjustive maneuvers as a core set of techniques. As they progress through the curriculum, they practice both on each other and eventually on outpatients as they get into the clinic system. We think the focus for students should be learning a core set of techniques, and so we've set up our program in two different ways. The first is that the students learn a set of techniques in a generic way. So we have diversified, Gonstead, and a number of other techniques that are commonly used by chiropractors in practice. We focus on those in these regionally based classes. So we will focus on the cervical spine, the thoracic spine, the lumbar spine. As they learn these techniques, they get more confident with just the application of motor skills, the idea of having to adjust someone and the speed that's necessary to do that. During the program, students have the option of learning elective techniques. These techniques are in addition to the ones that we teach in the core curriculum. These are augmented by student clubs. And so if you're particularly interested in a technique like activator, Gonstead, numbers of other techniques, that students can work on the preliminary part of it, the posology as we would call it, the setups for these adjustments, and learn the basic approach to the analysis that's used in a lot of these technique programs. By the time you get to clinic, you have the option of having taken electives. So these electives are preparatory for the clinic, so that when you learn a technique like activator, SOT, Gonstead, that when you enter the clinic, those techniques are actually allowed, so that under the supervision of a clinician you can apply those to patients. So we try to approach it from 3 or 4 different angles. We approach it from the angle of, we want you to know the techniques that all chiropractors use in practice. We want you to know the techniques you're interested in. And we want you to have both the information in a classroom setting, practice it all the way through your education from third quarter all the way through the clinic, and then under the supervision of a clinician who's usually well versed in all these techniques, supervise your application of that on outpatients.